If you exercise regularly, eat your vegetables, keep your weight in check, and still had a heart attack, or know someone who did, this video is going to completely change how you think about heart disease. Because here's the truth that cardiology research has known for over a decade, but that almost nobody is talking about in plain English. Nearly half of all heart attack victims had normal cholesterol. Not borderline normal, actually normal. Their lipid panels came back clean. Their doctors told them they were fine. And then they had a cardiac event anyway. So if cholesterol isn't the whole story, if eating well and exercising isn't a guarantee, what is actually killing these people? That's exactly what we're going to break down today. The real, under-the-radar mechanisms driving heart attacks in people who appear perfectly healthy. And more importantly, the specific things you can start doing right now to actually protect yourself. Things that go way beyond eat less saturated fat and take a statin. Hi, I'm Dr. John, and I can tell you, the patients who shock us the most aren't the ones who are obese, sedentary, and eating fast food every day. The ones who shock us are the 47-year-old marathoner, the 52-year-old yoga instructor, the guy who just passed his annual physical with flying colors 2 months ago. These are the cases that keep cardiologists up at night. And they keep happening because mainstream medicine is still measuring the wrong things, warning people about the wrong risks, and completely missing the hidden biology that leads to sudden cardiac death. In this video, I'm going to walk you through exactly why healthy people have heart attacks. The 3 hidden mechanisms your doctor almost certainly didn't test for at your last checkup. The single most dangerous thing happening inside your arteries right now that has nothing to do with cholesterol. Why chronic stress may be more dangerous to your heart than smoking, and the measurable biological pathway that explains it. The specific advanced blood tests you need to ask for by name, because standard panels will completely miss these. And the 5 evidence-backed interventions that protect your heart at the cellular level, not just on paper. Quick favor before we dive in. A lot of people tell me they've watched several of my videos and never subscribed. Please take 2 seconds and check right now. It's free, and it helps real, evidence-based information reach more people who genuinely need it. Thank you. The myth of the clean bill of health. Let's start with the fundamental misunderstanding that puts millions of people at risk every single year. When you go to your doctor for a routine checkup, they typically measure 4 things related to your heart: total cholesterol, LDL, HDL, and triglycerides. If those numbers look reasonable, you get a thumbs up and you leave feeling reassured. But here's the problem. That standard lipid panel is like checking if someone is a safe driver by asking if they own a car. It gives you almost no information about what's actually happening inside your arteries. A landmark study published in the Journal of the American Medical Association, one of the most rigorous cardiac studies ever conducted, tracked over 136,000 patients hospitalized for coronary artery disease. The finding was staggering. Nearly 75% of these patients had LDL levels that were considered normal or even optimal by standard guidelines at the time of their heart attack. 3/4. Normal cholesterol, heart attack anyway. So what were their doctors missing? 3 things. And once you understand all 3, you will never look at a standard cholesterol test the same way again. Hidden mechanism number 1. Inflammation, the real fire inside your arteries. Think of your arteries like a highway. Cholesterol particles are the cars. For decades, we've been obsessed with counting the cars. But what actually causes a heart attack isn't the number of cars on the highway. It's a pothole, a crack in the road that causes a pileup. That crack is inflammation. When the inner lining of your arteries, called the endothelium, becomes inflamed, it gets sticky and damaged. Cholesterol particles that would normally pass right through begin embedding themselves into the arterial wall. Your immune system, trying to help, sends white blood cells to the site. They engulf the cholesterol and become what scientists call foam cells. Those foam cells accumulate and form a plaque. That plaque grows silently for years. Then one day, the plaque ruptures. A blood clot forms instantly, and the artery closes off completely. That's a heart attack. Not caused by too much cholesterol floating around, caused by inflammation that created the wound in the first place. And here's the devastating part. You can have sky-high levels of arterial inflammation with a perfectly normal cholesterol panel. They are almost entirely unrelated measurements. The good news is that inflammation is measurable, but you have to know to ask for the right test. The marker you want is called high-sensitivity C-reactive protein, or hsCRP. This is different from the standard CRP test ordered for infections. The high-sensitivity version detects low-grade chronic vascular inflammation, the slow burn happening inside your arteries right now. The Jupiter trial, a massive randomized controlled study involving nearly 18,000 patients, found that people with elevated hsCRP but normal LDL had dramatically higher rates of heart attack and stroke. And treating those people aggressively reduced cardiovascular events by 44%. Not because their cholesterol dropped, because their inflammation dropped. Ask your doctor for an hsCRP at your next visit. Normal is under 1 milligram per liter. Borderline risk is 1 to 3. High risk is above 3. Most people have never had this test run. Most doctors never order it unless you ask. Hidden mechanism number 2. Small dense LDL and oxidized particles. The real danger inside your cholesterol number. Here's where it gets more nuanced, and where standard medicine is still decades behind the research. Your standard LDL reading tells you how much cholesterol is being carried in LDL particles, but it tells you absolutely nothing about the size or quality of those particles. And that distinction is the difference between someone who's genuinely protected and someone who's one stressful year away from a cardiac event. Imagine LDL particles come in 2 sizes, large fluffy ones and small dense ones. Large fluffy LDL particles are like beach balls. They bounce off the arterial wall harmlessly. Small dense LDL particles are like tiny golf balls. They penetrate the arterial wall easily, get oxidized, and trigger exactly the inflammatory cascade we just described. 2 people can have identical LDL numbers and completely different cardiovascular risk profiles depending on which type of particle dominates their blood. The test that measures this is called an LDL particle size test, or an NMR lipoprofile. The advanced version measures your total LDL particle count, called LDLP, which is far more predictive of heart attack risk than standard LDL-C. A study published in the Journal of the American College of Cardiology followed patients for over a decade and found that LDL particle number, not LDL cholesterol, was the most accurate predictor of cardiovascular events. People with high LDL-C but low particle numbers had near normal risk. People with normal LDL-C but high particle numbers had dramatically elevated risk. Same cholesterol number, completely different outcomes. And what drives small dense LDL? Not dietary fat alone. The primary driver is metabolic inflammation, insulin resistance, and high blood sugar, the exact conditions being created silently in millions of people who eat reasonably healthy but have no idea their metabolic machinery is already misfiring. Which brings us to the third hidden mechanism, the one that surprised me the most. Hidden mechanism number 3, chronic stress and cortisol, the cardiac killer nobody talks about. If I told you that chronic psychological stress increases your risk of a cardiac event by 27%, you might not be shocked. Stress is bad, we know that. But the biological mechanism behind it is something most people, and most doctors, have never fully explained. Here's what's actually happening. When you're chronically stressed, whether it's work pressure, a difficult relationship, financial anxiety, or just the low-grade background noise of modern life, your adrenal glands pump out cortisol. Cortisol, in short bursts, is healthy. It's what gets you out of danger. But cortisol running high all day, every day, is a metabolic catastrophe. Elevated cortisol does 4 specific things to your cardiovascular system. 1. It raises blood sugar directly by triggering your liver to release glucose, even when you haven't eaten anything. This chronically elevates insulin, promotes small, dense LDL production, and increases arterial inflammation. 2. It causes direct endothelial damage. Cortisol degrades the nitric oxide your arterial lining produces. Nitric oxide is what keeps arteries flexible and dilated. Without it, arteries become stiff and narrow. Blood pressure rises. Clot risk increases. 3. It promotes visceral fat accumulation around your organs. That visceral fat isn't just sitting there. It's an active endocrine organ, pumping out inflammatory cytokines, the same chemicals that damage the arterial wall. 4. It dysregulates your autonomic nervous system, keeping you in a chronic, low-grade fight-or-flight state that increases heart rate variability risk and electrical instability in the heart muscle itself. The Whitehall 2 study, one of the longest-running cardiovascular studies in history, tracking British civil servants for over 20 years, found that chronic work stress was associated with a 68% increased risk of heart disease in men and women who otherwise appeared healthy by conventional markers. Not smokers, not the obese, healthy-seeming working professionals with elevated chronic stress. The test that captures this? Morning fasting cortisol and, increasingly, heart rate variability, measured by many modern smartwatches, which is a window into how well your autonomic nervous system is recovering from daily stress load. The 5 things that actually protect your heart. Now that you understand what's really going on, here's what the evidence says you should do about it. Not generic advice, specific, mechanistic interventions backed by controlled research. Intervention 1. Omega-3 fatty acids at therapeutic doses. Not the 300 milligram capsule from a drugstore multivitamin. Therapeutic doses. The Reduce It trial, a landmark study involving over 8,000 high-risk patients, found that 4 grams daily of purified EPA omega-3, eicosapentaenoic acid, reduced major cardiovascular events by 25% independently of LDL reduction. The mechanism is direct. EPA reduces triglycerides, decreases small dense LDL particle formation, lowers HSCRP, and stabilizes arterial plaques so they're less likely to rupture. Get your omega-3 index tested. You want it above 8%. Most Americans sit at 4 to 5%. Intervention 2. Magnesium. This is the most underappreciated cardiac mineral in medicine. Magnesium regulates over 300 enzymatic reactions, including every single step of ATP energy production in your heart muscle cells. The heart is the most metabolically demanding organ in your body. It never stops working. And it requires magnesium to function at every beat. A meta-analysis published in the European Journal of Clinical Nutrition found that for every 100 milligrams per day increase in dietary magnesium intake, risk of cardiovascular disease fell by 22%. Yet studies consistently show that over 50% of Americans are magnesium deficient, and standard blood tests don't catch it because only 1% of your body's magnesium lives in the blood. The rest is in your cells and bones. Ask for a red blood cell magnesium test, not a serum magnesium. Foods highest in magnesium: pumpkin seeds, dark leafy greens, dark chocolate, and legumes. If supplementing, magnesium glycinate or malate are the most bioavailable forms. Intervention 3. Zone 2 cardio, not high intensity. Here's something that surprises a lot of people. Extremely high-intensity exercise, when done chronically without adequate recovery, can actually elevate HSCRP and increase cardiac stress. The marathoners who drop dead aren't dying because they're fit. They're dying because years of extreme endurance training without recovery has created arterial calcification, elevated cortisol load, and atrial remodeling. The most cardioprotective exercise is Zone 2 cardio, aerobic exercise at a pace where you can still hold a conversation but are definitely working. 150 to 180 minutes per week at this intensity has been shown to directly increase nitric oxide production, lower HSCRP, improve insulin sensitivity, and grow new capillary networks around the heart muscle. Think brisk walking, cycling, swimming at a comfortable pace. Not intense, sustainable, consistent. That's what protects your heart. Intervention 4. Sleep, the cardiac reset you can't supplement your way out of. A study in the European Heart Journal, tracking over 460,000 people across multiple countries, found that people sleeping fewer than 6 hours per night had a 48% higher risk of developing or dying from coronary artery disease. Not a small effect, nearly 50% higher risk. The mechanism is direct. Deep sleep is when your body clears inflammatory debris from your bloodstream, repairs endothelial cells, resets cortisol, and restores heart rate variability. Miss this window consistently, and the repair crew never shows up. Inflammation accumulates, arterial damage compounds, and then one day, at a routine checkup, or worse, your doctor is shocked. 7 to 9 hours, consistent bedtime and wake time, a cool, dark room. These aren't lifestyle suggestions, they're cardiac medicine. Intervention 5. Reduce postprandial blood sugar spikes. This one is almost never discussed in standard cardiology clinics, but the data is crystal clear. It's not your fasting blood sugar that matters most for arterial health. It's the spike after meals, called postprandial hyperglycemia. Every time your blood sugar surges sharply after eating, you get a burst of free radicals in your bloodstream that directly damage the endothelial lining of your arteries. Do that 3 times a day, every day, for years, and the damage accumulates even if your fasting glucose looks fine on paper. The fix is simple. Eat fiber and protein before carbohydrates at meals, a technique called food sequencing. A study published in Diabetes Care found that eating vegetables and protein first, then carbohydrates, reduced the post-meal glucose spike by up to 73% compared to eating carbohydrates first. Same food, different order. Dramatically different effect on your arterial wall. A short 10-minute walk after eating also reduces post-meal glucose spikes by up to 30% by directing glucose into working muscles rather than the bloodstream. The tests you need to ask for by name. Let me give you the exact shopping list for your next doctor's visit. Standard panels won't catch what we've talked about today. Ask for these specifically. HSCRP for arterial inflammation. Goal, under 1 milligram per liter. NMR lipoprofile, or LDL particle count, LDLP, for true cardiovascular risk beyond LDL-C. Omega-3 index, goal above 8%. Red blood cell magnesium, not serum magnesium. Fasting insulin, a far earlier warning sign of metabolic dysfunction than fasting glucose. Goal, under 6 UMI/IU per milliliter. Lipoprotein A, or Lp(a), a genetically determined particle that dramatically raises heart attack risk and is missed by every standard cholesterol panel. About 20% of the population carries elevated Lp(a) and has no idea. Many doctors will order these if you ask. Some may push back. If yours won't discuss them, consider seeing a preventive cardiologist or a functional medicine physician who routinely runs advanced cardiovascular panels. What to take away from all of this? The reason healthy people have heart attacks is not bad luck. It's not random. It's not because their genetics betrayed them without warning. It's because the medical system is measuring the wrong things. And most people have never been told what to actually look for. Heart disease develops silently over 10, 20, sometimes 30 years before a single symptom appears. It starts with inflammation. It accelerates with metabolic dysfunction. It's fueled by chronic stress and poor sleep. And it culminates in an event that everyone around you will call sudden, even though your body had been sending signals the entire time that nobody was looking for. You have far more control over this than you've been led to believe. The person who survives into their 80s with a strong, healthy heart isn't just lucky. They're measuring the right markers. They're eating in ways that reduce inflammation. They're sleeping. They're managing stress with the same seriousness they'd manage a medication. They're moving their body at the right intensity, consistently. None of this is extreme. None of it requires a prescription. It just requires understanding what's actually happening inside your body and making decisions with that knowledge. Start with one thing from today. Get the HSCRP test. Take a 10-minute walk after dinner. Eat your vegetables before your carbohydrates. These aren't small things. At the cellular level, they are exactly the signals your cardiovascular system has been waiting for. Quick recap of everything we covered today. 1. Nearly half of heart attack victims have normal cholesterol. Standard lipid panels miss the most dangerous mechanisms. 2. Arterial inflammation, measured by HSCRP, is the root cause of plaque formation and rupture, not cholesterol alone. 3. LDL particle size and count, not just LDL cholesterol, determines real cardiovascular risk. Ask for an NMR lipoprofile. 4. Chronic stress elevates cortisol, damages the arterial lining, promotes visceral fat, and increases cardiac event risk by up to 68% in otherwise healthy people. 5. Therapeutic omega-3s, magnesium, zone 2 cardio, quality sleep, and food sequencing are 5 evidence-backed interventions that protect your heart at the biological level. 6. Ask for hsCRP, LDLP, omega-3 index, red blood cell magnesium, fasting insulin, and Lp(a) at your next checkup. These are the tests that actually reflect your cardiac risk. Your heart has been working every second of every day of your entire life without you ever asking it to. The least you can do is give it the right information to work with. If this was useful, please share it with someone you care about, a parent, a friend, a colleague who exercises and eats well and thinks they're completely in the clear. Over 800,000 Americans have a heart attack every year. Most of them had no idea it was coming. That doesn't have to be the story. Subscribe, hit the like button, and check out my other videos on inflammation, metabolic health, and sleep science. The links are right here on screen.